Good afternoon, ladies and gentlemen. My name is Rudeetip Smithsarakarn from Pramongkutgao Hospital and College of Medicine. Today, I would like to present about an update on total elbow arthroplasty. Here's the outline for today. So before we begin, it's essential to understand total elbow arthroplasty. This surgical procedure aims to relieve pain, restore function and mobility, and provide stability for patients suffering from severe elbow joint disorder. So let's start with the history of total elbow arthroplasty. Dates back to the 1940s when elbow resection were initially performed, but due to high bone loss, so the first elbow replacement, a hemi-arthroplasty, was introduced in 1947. However, it failed due to poor fixation and a limited understanding of joint kinematic. So after that, by the early 1970s, implant design was improved and cement fixation was introduced. Designed by Dr. Roger D. with cement fixation, but failure rate still high, up to 100%, because of too rigid fixation, so leads to loosening of implant. So over the time, the modern era of total elbow arthroplasty then emerged. And here's the design for the modern era of total elbow arthroplasty. It's developed to provide better stability. Before we start, let's start with the indication first. So the indication for total elbow arthroplasty was primarily for the rheumatoid arthritis, osteoarthritis, complex fracture, particularly in elderly patients, and failed previous surgery with elbow surgery. So what's the update on the indication? From the systematic review in 2022, they showed that a significant increase in the use of total elbow arthroplasty for acute trauma case. As you can see from the chart, that the orange color is represent acute trauma patient. It's increased double. So this because of the advantage of total elbow arthroplasty over the fixation. It's provide faster and easier rehabilitation. So is total elbow arthroplasty more popular nowadays? From JSES review in 2024, the overall volume of total elbow arthroplasty was decreased about 30%. The highlight decline from rheumatoid arthritis. As you can see from the orange line, due to the advance in medical treatment, the DMARD, so the patient that have to confront elbow arthroplasty was lower. So this journal also showed that no rheumatoid arthritis patient under age 45 underwent total elbow arthroplasty anymore since 2018 from the state. However, the fracture indication still same and remain steady. So when you meet the patient with complex distal humeral fracture, what should we do? Arthroplasty or fixation? So this is the retrospective review in 2024. They're comparing the arthroplasty and fixation for AO type B and C for distal humeral fracture in 83 patients, mean age about 75 years old. The majority of total elbow arthroplasty was for the AO to A type C2 and C3, which mean complex fracture articular. So the result was follow-up up to 6 years, and the arthroplasty showed significant lower complication and reoperation rate compared to the fixation. So you should considering the total elbow arthroplasty for the alternative treatment when you meet the patient with distal humeral fracture in elderly patient. From other recent journal, they compare the fixation and arthroplasty. Almost all show that the arthroplasty gives similar functional outcome result compared to the fixation. And the total elbow arthroplasty was early rehabilitation, but it's suitable for the patient with age more than 65 years old with the AO to A13C. But the long-term outcome still up for debate. So just keep in mind that when you're encountering a complex distal humeral fracture in elderly, the treatment for the arthroplasty could be an option. So to be conclude about this, what should we do when we meet the distal humeral fracture? If you see a patient over 65 years old with complex distal humeral fracture, you could consider about the arthroplasty because compared to the fixation, it had shorter operative time and allow immediate mobilization, which no significant difference in functional outcome and range of motion. So let's move to the type of implants. The modern era of implant, nowadays we have three main types: the link design, unlinked design, and convertible design. Start with the link design. The link design is the link articular which provide intrinsic stability. But this one have high loosening rate because of the mechanical failure from the mechanical stress. So after that, they have the unlinked implant design. This one was designed to reduce the loosening lower because of the articular resurface implant. So they decrease the strain on the bone implant interface. But this design, they need a good soft tissue and strong ligament to work properly. So it's making surgery take more technical demand. If the ligaments are not strong enough, it could lead to instability. And the last one, the last generation, is the convertible design. This one allows surgeons to choose between the link and unlinked design intraoperative. But however, in Thailand, now we have only the first one, the link design. For the outcome, here's an update on long-term outcome survival from a Norwegian study in 2018. It showed promising midterm result with over 90% survival rate at 5 years, as you can see from the graph. But for the long run, the survival dropped to 60% at 20 years. So, and the overall complication and revision also high for the arthroplasty in the total elbow. If we compare the elbow arthroplasty with other arthroplasty like total knee and total hip arthroplasty, as you can see that the elbow result was not that satisfying. So the elbow is much lower than total hip and total knee arthroplasty with higher complication and revision rate. Is there any difference in the outcome between the implant design? So what's the update? We will talk about this. Which one we should use, the link design or unlinked design? This is the meta-analysis in 2022. They show that the linked implant are better than unlinked one because of the long-term longevity of the implant. And from the systematic review in 2022, the linked design have a lower revision rate compared to the unlinked design. The most common complication with linked design is polyethylene wear due to repetitive strain. And the most common complication for the unlinked design is aseptic loosening, because of the multi-axial force. And from the capsuloligamental laxity, the unlinked design have higher dislocation compared to the linked one. To be conclude, the link versus unlinked design. For older patients with severe joint destruction and limit of bone stock, a linked implant design is typically recommended, which is usually seen in trauma case. But in the other hand, if the patient is younger and still have good ligament and adequate bone stock, the unlinked design could be more appropriate because we can preserve the bone for in the future revision. And this one also compared the linked design with the convertible design. They're the data from the New Zealand. They also show the same result that the linked design is better than convertible design. The revision rate is lower if compared with the convertible design. So what's about the complication? The complication of total elbow arthroplasty ranged from 10 to 40%. The most common complication was aseptic loosening, followed with the infection and periprosthetic fracture. So is there any update on the factor of failure? From the systematic review in 2024 about the prognosis factor failure, the fracture frequently and male gender was additional risk for implant failure. And the obesity patient also increased the hazard ratio about 3.8. And compared with the design, the unlinked design's failure more than linked design. So, conclusion. The total elbow arthroplasty has proven effective in improving range of motion and pain relief. However, long-term survival remains challenging with a 60% survival rate at 20 years. So we should rethink about it. We should delay the total elbow arthroplasty as long as possible to optimize the outcome. And total elbow arthroplasty could be a preferred choice for complex distal fracture due to the better outcome compared with the internal fixation. Thank you.